From the beginning of pregnancy, babies will explore their world.
And many times when we assess them, they will be transverse, they will be in so many different positions, which is actually their right to explore their world. But usually, after 36 weeks, the baby will actually begin to choose a position for birth. Most times, the babies will come cephalic, but 6 to 10% will choose to remain breech. Hello, I am now Livina Ver, and I am going to share with you the protocol that I have used for over 30 years to turn breech babies into cephalic position. In this exercise, the woman is going to place a couple of pillows under her knees and 1 or 2 pillows for her to place her face and for her neck to be comfortable. Her arms can be near her face or in any position that she feels more comfort. Her hips will be as high as possible on a 45-degree angle or higher, while her legs remain perpendicular to the floor. Since she will remain in this position for 20 minutes, some women choose to put a few pillows under their bellies to avoid their backs giving in to the weight of the belly.
Now that the baby's head is pointing downward, the pull of the gravity will be an invitation for the baby to turn. After holding for 20 minutes, to come out of the position, have the woman walk her hands back up to a sitting position and just give a nice long stretch. Even though breech babies can be born successfully in a vaginal way, ideally, a baby that is born head first is known to have less complications or less risk factors.